Welcome back to another episode of The Edge. I'm your host, Natalea Hillen. All over America, high school students are struggling with neck and back problems. Teens are constantly in sudden pain and are affected from looking down at their schoolwork at their desks, looking down at their phones, and carrying around heavy backpacks all day. In the future, teenagers will be highly affected with neck and back pain. Today, I will be interviewing Dr. Christopher S. Carr. He is a chiropractor that adjusts patients and provides wellness on a daily basis. He has been practicing in Peters Township since 2007, serving patients mostly in Allegheny and Washington counties. He's here to inform us on how teenagers can avoid stress on their back and neck, if teenagers are dealing with it, and how to address it properly. So, Dr. Carr, what are some reasons that teenagers come to your office?
So I see teenagers for many different options. I see them for typically migraine headaches, tension headaches. Also, I see patients for lower back and neck pain. And then I'll see them for sometimes we'll have numbness, tingling as well if the problems exacerbate and get worse over time.
So how can teenagers prevent these neck and back problems that they come to you for?
They can prevent them. So one is recognizing where the problem's coming from. So they can prevent them from addressing the issue. So I know kind of today we're going to talk about texting and phones. And when I was growing up, cell phones didn't exist. They just weren't there. The average kid now will be on the phone a teenager will be on the phone anywhere from 2 hours a day, sometimes 3 hours on weekends. So it's chronic overuse of doing the same thing. Consider a car accident, which is a big macro trauma. So if I'm in a car and we get in a car accident, it's considered a large trauma. What a micro trauma is something you do small, incorrectly, day in and day out. And that adds up over time, turns it into a larger trauma. And that's typically what I'll see in teenagers from either overuse injuries or things like texting and things like that.
So the micro trauma, that's basically like the number one thing that you see with teenagers is that on like thing.
Yeah, usually it's not so much from a large factor, not so much from a nasty car accident, but from overuse from sports injuries, from training, from year round with not taking any time off, or from always looking down and putting a lot of stress in their upper back and their neck.
Do a lot of teenagers come to you like at the same, like they come to you and then they go, but then they have to come back again for that same problem?
So it's different. Everyone's different in what they recommend or what is needed. Sometimes the problem's corrected and they just come more on a maintenance basis. Think of your dentist, for example. When you see your dentist, you'll see the dentist for him or her for twice a year, regardless of how you feel, right? Just 6 months. Just like how your mouth can decay, your spine can as well. So you want to keep it healthy, and we do that through adjustments in the office.
So your spine is basically connecting like your whole body together. So can you like kind of explain like the spine, like how it kind of affects daily life?
You got it. So what controls the body? It's your brain, right? I always say we don't have Wi-Fi in our body. We are wired head to toe. So for you to interpret what I'm saying, for you to digest your lunch that's coming up, for you to sleep, talk, everything takes place through your central nervous system. Over time, what happens from poor posture, from strenuous work conditions, from poor sleeping habits, those minor traumas you sustained, over time, that message that starts in your brain, it's got to go somewhere, and the way that it gets there it runs down through these spinal nerves. And those nerves go to every cell, muscle, tissue, and organ in your body. As long as there's no pressure on that system, you're in great shape. But what happens from these things we were talking about is you now have interference on that system, then eventually you can have symptoms, whether it's neck pain, back pain, headaches. But unfortunately, you don't get symptoms right away. You have to lose about 40% of your health before you get that first headache or that first lower back pain or that first acid reflux. So the body, although the only way we can tell if something's going on is through pain, by the time pain shows up, typically it's been going on for some period of time.
What is the worst case you've seen with a teenager with their neck, related to their back or neck?
So I've seen broken necks, which is very severe. I've seen patients post-surgery who've had surgery on their necks. And I'd say it's probably the most severe that I've seen.
So how long is the treatment for an average kid that goes for their neck and back problems?
So it varies. Everyone's different, depending on, I always say that if it's the farther away the problem is on the body, usually the longer it takes to heal. So if it's just, say, if it's a musculoskeletal pain, whether it's just a neck pain, if it's just localized closely to the neck, it can usually heal in 4 to 6 weeks. If you're getting numbness into the arm and it's shooting all the way down into the fingertips, we know that that problem is going to take a lot longer to heal.
So I know from my experience, I did come to you whenever I had back problems related to dance, like a dance trick.
Right.
Do most of your problems come from sports, or is it mostly like looking down at phones nowadays?
Yeah, so it varies. A lot of it, I've been in practice since 2004, so I'm going on 16 years now. In my earlier career, I would not see young adults that would be training year-round for various sports, whether it's soccer, football, dance. There would be time off. Now it is a consistent overuse where there's just no downtime. Maybe a couple weeks here and there, but it's pretty much a year-round thing. So that is kind of what plays a factor into it.
So kind of at night, like kids, sleep, what type of pillows could help the neck out when they have problems like this?
So most folks sleep on their belly or on their side. So when if you're a belly sleeper, you obviously can't keep your head straight down into the mattress. Okay, you need a place to breathe, so you have to rotate your neck to the left or to the right. So the best way to sleep would be on your back, and there's a couple different types of pillows you can use. There's something called a cervical pillow, and it looks like a regular pillow except it has an indentation out in the middle of it. And the reason behind that is that it produces support into the neck. So the bottom portion of the pillow, the fibers in it are a little more firm that produce that extra curvature into your neck, gives you that extra support. Whereas other pillows that are very soft, like those Tempur-Pedic pillows, or the ones that have a lot of cushion to them, when your head kind of buries into it, there's not a lot of support into those. So the best way to sleep is on your back using a cervical pillow. You can also use, they're called sleep aids, and they look like pool noodles, if you will, that are just kind of cut to the size of your neck, a little longer, and that puts your neck into proper alignment as well. That's died and gone to heaven for sleeping. A lot of folks don't do that. A lot of folks are side sleepers, so the best way to sleep that way is you can still use one of those cervical pillows with the indentation cut out, and then you can put a small pillow between your knees, and then that in turn will level out your pelvis.
So I sleep on my stomach a lot, and I know like it's kind of hard to switch your position. How do you kind of train your body to switch positions whenever you're sleeping?
Well, the old adage is it takes 21 days to break a bad habit. So it's just something you have to do repetitively over time. And I always say just go as long as you can, and then whenever you're ready to go to bed and you're tired, then go back to sleeping the way that you are. But over time, if you do it each and every day, you can retrain the body to change that behavior.
Okay, awesome. So kind of going on a different scale for backpacks, do you see a lot of kids that come for their back pain, and do you kind of relate it back to backpacks?
I'll see them for back pain, whether it's coming strictly from that. It's tough to say whether that's the overriding factor. It's no secret that backpacks have gotten very heavy over the years. The amount of books, the amount of materials that young adults need to take from class to class has not gotten smaller in size, it's gotten larger. And that's one of the factors that can produce it.
So starting from your career and to now, if you look back,
right.
Can you see an increase in the amount of teenagers you've had?
Of course, yeah, I think anything. As you get more experience, initially out of practice, just like anything, you're inexperienced. You don't have, outside your clinical rounds you do in school, you still have some experience. We don't have a whole heck of a lot. You get your feet wet after a year or two, find out what your specialty is, what your niche is, and mine has become a family-based wellness practice. We see a ton of families, and we do that by educating the parents on why the kids should get checked. So as time's gone on, of course, we see lots of kids as soon as they're born to their later teenage years.
What is the biggest long-term effect in a kid, in 10 to 15 years, if in the future?
What it can happen?
Yeah, to their backs.
Yeah, so if it's not addressed, we're now finding that it can be early onset arthritis into the lower back, into the neck. And what arthritis is it's a inflammatory condition that will break down the structure of the spine. We see that can then develop into various types of what's called neuropathy or numbness or tingling into the extremities. You used to never see that. I used to never see early onset arthritis in folks in their 20s, and now I see it into the mid-20s.
So the arthritis is kind of starting with the younger kids now and going for the future and older people. It's
a building block. It's one of the things that's just not addressed at an early age, and we were never, although we had been looking down, when I was growing up, we would study, but we weren't locked and loaded into a phone for a couple hours a day. We weren't having iPads or tablets. It just didn't exist. So it's a new problem that has risen due to technology, and that over time can produce some of these issues we're seeing now.
So what is the hardest thing about your job whenever you look at these different cases? Like, what is the hardest thing for you as a chiropractor when you're looking at these different cases?
And not so much that anything's hard about it, it's more so just educating it and trying to work on correcting the problem. I can adjust the patient every day to fix it, but if they don't change the underlying behavior, then typically they're not, it's going to keep on repetitively reproducing itself. So changing the behavior.
What happens, so whenever people are wearing their backpacks, I know like even me, like your posture's affected by it. What's some ways that we can increase, like even wearing a backpack, what are some ways we can still help out our back even when it's heavy?
So recognizing how much weight's in the backpack. So what the pediatricians will say, or those who have studied backs, they'll say 10 to 15% of the body weight. So you would get on a scale and you'd weigh yourself, and then you put your backpack on and you'd weigh yourself again. And you'd see if it was 10 to 15 within those limits. If it's not, then you'd have to try to redistribute that weight. Ways you can do that are buying a backpack that has wider shoulder straps. That helps out a ton. Buying backpacks with compartments in them as well, where you can put and redistribute the weight in various places so it's not all solely focused into the central part of the backpack. Using a backpack that has a waist strap to it, and that will help also keep a backpack closer to the body and keeps the force distributed closely to the back itself. Using both straps instead of one is another option you can use, and that will help out a ton.
So what other parts of the body are affected by backpacks? I know like your spine and everything, but there's definitely other factors that are unaffected by it.
Yeah, so over time, so from poor structure, your body compensates. It's not just your lower back that plays suit, it's your lower back that then in turn goes into, now your body has to compensate for extra force on your lower back, and now you'll cheat, now you'll start to round the upper back. And when your upper back rounds, what has to happen to the head? Well, the head has to go forward, it has nowhere else to go. So now it's called forward head posture. When the head goes forward, okay, that goes forward, now that causes that upper back to round. Picture your head like the weight of a bowling ball. It's about 10 pounds. Each inch you carry forward adds an extra 10 pounds of weight to your upper back. Wow. So just a 2 or 3 inch forward head posture puts about an extra 30 pounds on that upper back.
Wow, that's crazy. A lot of kids don't know what they're getting into, like when they look back in their early like teenage years, they're not realizing that it has a huge effect on their life and everything.
Yeah, because I was young in your age at one point, and it's you never think it's going to be you until it's you. And,
exactly.
And you have the time goes by very quick. It flies. But I understand that hearing this message, being your age, like, it's not going to happen to me.
Yeah,
and it's just not
exactly.
It's not as much of a factor of that yet, but it can come up down the road.
Well, thank you so much. We are now going to take a commercial break. We'll be back to talk more about things regarding teenagers' neck and back problems. Welcome back to The Edge. So Dr. Carr, can you please tell me some ways that kids can also, regarding the heavy backpacks, other ways that they can help with their nutrition and daily activities for their back?
For their back. So when it comes to nutrition, you have to think of inflammation. Things that we eat, good food does not produce inflammation. Bad food does produce inflammation. What inflammation is, they say it's the precursor to all or most diseases. So when we look into the standard American diet and what inflammatory food consists of, we look at sugar, salts, various types of bread, and the rule of thumb is that if you put something in your mouth and it turns to mush, that's how you know it has some type of sugar in it. So if we had a piece of bread here and we put that in our mouth and we just let it sit there, it will turn to mush. If we put a cupcake in our mouth or a French fry or a potato chip, same thing. That's how you know it's going to break down the sugar, which then in turn will break down the fat. And any type of sugar-based food will have an inflammatory process. On the flip side, if we had a piece of broccoli here and we put that in our mouth and just sat there, it's not going to turn to mush. So I call it the mush test. That's what I've been teaching for years. So how do you decrease inflammatory foods? One is recognizing what to eat and what not to eat. Inflammatory foods are things such as the fried foods. Typically anything white is going to be a simple or refined carbohydrate, with the exception of various types of almond milk and things like that, or fat or organic yogurt. When you can decrease inflammation over time, that decreases inflammation in your blood. When you have a lot of chronic muscle tension, which comes from poor usage, from posture, from a heavy backpack, from looking down, when you can decrease that inflammation in the muscles, that will help long term with it. So nutrition plays a role, although we still would have to go back and get to the actual issue and address the cause. And if we were able to go back to say, hey, you know what, I think it is the backpack. The backpack weighs 25% of my body weight. Until we would address that issue, it would still become a recurring issue for you.
So at home, what are some things that people can start doing to start that diet early and start realizing that they have a problem with their nutrition? And
so what can they do to change the diet?
Yeah.
So you can change the diet I always say, take 2 or 3 things a month and start there. If you try to do everything at once, you try to change 5, 6, 7 things immediately, it's going to be system overload. The body's not going to want to do it.
Exactly.
And then 6 weeks later, it's going to be like, you know what, I'm good. And you're back into the old behavior pattern. So whatever those 2 or 3 things are, you need to change. Some people need to hydrate. Some do not drink nearly enough water. The rule of thumb for hydration, it's half your body weight in ounces every day. So if you're 150 pounds, you should be drinking 75 ounces of water per day. You would also want to decrease the things that dehydrate you. So you're drinking a lot of coffees, sodas, teas, anything that are acidic in nature causes your body to become inflamed. So work on decreasing those things as well on a nutritional basis.
Because I know with water, I know like sometimes I don't drink enough and I need to drink more, but I feel like I don't get thirsty, but I know like that's when you need to drink water. So what's kind of a way that should I just have like a water bottle next to me kind of like every second trying to refill stuff or?
Yeah, so you can mark it each day, try to keep track of the amount of ounces you're taking in. There's an app you can put on a phone that will keep track of water intake for you. And that's how you would know if you're getting in enough or not enough each day.
At home, what are some like remedies like you can do to like help you with like your spinal problems or neck?
Stay active is one. Don't be sedentary. Sitting in front of a computer, in front of an iPad, gaming for hours on end, it's just terrible for the back and for the spine. Building your core, the primary stabilization for your lower back and your neck is having a strong core. So working out, taking brisk walks, hitting the gym, any type of physical activity is going to work on improving that overall, the health of your overall body.
Okay, so awesome. So whenever I am like sitting down doing my homework, my neck, I'm always looking down and my neck always ends up hurting so bad. Like what's a way I can reduce that like strain?
So if you're always looking down, we then would want you to look straight ahead. So there are things you can buy where you can put your book straight in front of you. It's something you can lean forward. That way you're looking at more of a straightened angle. You're right. If you're always looking down and you're doing that 2 or 3 hours a night, it's that micro trauma we were talking about earlier.
Yeah, the effect is going to be worse at the end.
Got to address the cause, right? You have to go back to the basics. So until you address that cause of looking down, it's going to continue to be an issue for you. So then you would want to look straight ahead.
So going to like phones and stuff, looking up at your phone like this is you can't do this. You want to make sure that you're like reading at eye level instead of looking down.
Yeah, and most people aren't going to do that. So I'm realistic to realize like that advice sounds great, but a lot of people are. How many people you really see?
I see everyone literally looking down every second.
Yeah, so taking breaks is important. Decrease the amount of usage on it. So if it's on there for 2 or 3 hours, you've got to decrease that amount of time each and every day. And same thing, technology is good and bad. There's an app on your phone that can actually let you know how long you're on your phone every day. And it can be scary to know that. Yeah. And not only does it cause issues with the neck, we also look at the addictive behavior that comes for it. There's a psychological component that comes to it. It's like feeding the brain. Every time you look at it, your brain gets its little fix. Like, okay, I've looked at it, and it gives the brain that little the sensation. Okay, I'm good for a little bit, and then I can put it down. And then your brain tells your body again, hey, I need another fix. You need to stare at your phone again. It's very, very addictive.
So whenever you're sitting down at a desk, say, how should your posture be whenever you're sitting there? Like, can you kind of explain like?
Yeah, so it's the rule of 90. So you think everything at 90 degrees. So when you're sitting, say, at a desk studying, so your knees would want to be at 90 degrees. Your pelvis to your hips would want to be at 90 degrees. If you're sitting, elbows at 90, looking straight on. If you're on a computer, when you stick your hand straight out, the monitor should be right there, and that's where the tip of the monitor should be, and it should be centrally located. The screen should be centrally located right in the center of the eyes.
Awesome. So do you think that people will start to recognize their like problems that they have, or do you think it's just going to keep kind of going on until they kind of realize in 10 to 15 years they're going to be struggling?
Most, I think, will kick the can down the road until they get a symptom of some form. The Western folks, the American society, typically it's a reactive-based form of health. There's not a lot of attention put on prevention. A lot of it is put on reaction. So we wait for that migraine headache to get out of control. We wait for that acid reflux to really just be a mess. We wait for the weakness in our arm before we really address it. It's still instead of when it starts earlier on.
So what other reasons are people coming to you for like teenagers wise?
For teenagers, I see them for more so of a maintenance issue after their issues are addressed. Typically in teenagers, I'll see it's typically musculoskeletal in nature, whether it's neck pain, back pain, numbness, tingling, which isn't as common. Headaches are very common in teenagers. I'll see them for that as well.
So what major symptoms, like red flag symptoms, are they coming? Like they realize they have something and then they're reporting to you. Like what are those major like symptoms that they have?
The red flag ones are anything if you're getting any type of weakness in the extremities. So if you're walking up and down steps and your foot just doesn't seem to be working the way that it should. Any type of fine motor stuff. So if you're buttoning up a shirt and that's hard for you to do, or if you're dropping things when you're losing grip strength, any type of motor strength or numbness and tingling is a red flag that usually there's a nerve issue taking place.
So I know a lot of teenagers are kind of like, they kind of resist that they need help. They say that they refuse that they need help, and they kind of look at these red flags. But I feel like some people still say, oh, they don't need help. They don't need to get help. But there is a point where you do know. So like, what's that point that you know you need that help from you?
If you find yourself going to the medicine cabinet and taking some Advil or Tylenol on a daily basis or every other day, that's usually a flag that your body's trying to talk to you and you're masking the symptom through an over-the-counter. If you find yourself that your belly's upset all the time and you need to take a Pepto or some type of antacid for your stomach, anytime when you find yourself, especially at a young age, taking, whether it's over-the-counter or prescription medication often, then that's a sign that the body's not, it's called homeostasis, where it's not as healthy as it should be. And when it's outside that level, then we have to work into doing what can we do naturally to get it to a higher state of health.
Awesome. So like at your office, whenever you are treating people with neck and back problems, what are some things that you're kind of trying to teach them to do and some things that you're doing there?
So we do spinal corrective care. So we work on getting the spine back into proper alignment, not just through adjustments. We do it through in-office and home rehab, through various physical therapy devices we'll give to the patient or they'll have them do in our office to work on correcting the structure of the problem. Because until we really address, I work on patients, I'm working on bones and joints.
Yeah.
You still have to address soft tissue. You still have to address the muscles, ligaments, and tendons, and you do that through exercise.
Awesome. So I know you have some like wellness programs that you do a lot with a lot of people there. How many of them are teenagers? Do you have any teenagers that come for the wellness programs that you have a lot?
Yeah, so I'll see teenagers at that point for, typically for nutrition, we were talking about.
Okay.
Some teenagers are overweight, they need to lose some weight. So I'll see teenagers that need to get some weight off of them as well and change that behavior. And we'll see them for things outside of that and working on getting them exercise. My background is in exercise physiology as well, so getting them on a proper exercise regimen.
Awesome. So going back to, for your back specifically, we were talking about how backpacks have the different straps can help. Are there any other ways that we can help kind of eliminate that extra weight that we don't need on our backs?
If you know the weight's too much and you know it's over 15 to if it's over that 10 to 15% we were talking about, then you would take out, and there's no other compartments where you can redistribute the weight, and you have the straps, you're using the waist belt, then you would take out the extra and you would carry that with you, and that would redistribute the weight as well. that would be the recommendation for that.
Awesome. So aren't there waist straps that people can wear to kind of also eliminate that pain?
There are. Same thing, like I said earlier, I'm realistic and realizing how many teenagers in school have you seen wearing a waist strap? It ain't happening.
Yeah, my dad, going off of like kind of eliminating that backpack, my dad would always want me to wear like a roller backpack around the school. And I said, yeah, well, even if I did roll it, going up the steps, kind of lifting up, it's going to be kind of hard because we're not allowed elevators, like only if you're injured. So is that better? Is roller backpacks better than carrying something on your back?
If you were on a flat surface, yeah, but you would have the same issue. You'd then run into chronic shoulder problems.
Exactly, because you're lifting it up the steps.
Up 20 or 30 steps, and you're up and down the steps how many times a day?
A lot for me. I'm going zigzagging around the whole building there. So how will teens realize that they should not have a heavy backpack? Kind of going back to that initial start.
Yeah, they're going to watch this show and they're going to realize.
Exactly, they're going to see.
Like, I got this, I know it. They're going to know it because their body's going to start hurting. They're not going to feel good.
Exactly, like later on, they're going to realize, wow, I kind of need to get back on there.
Yeah, so when you get to college and you realize that the campus is 10 times, 15 times larger than this campus, and you realize like, I should change up a little bit.
Exactly.
Yeah.
Well, thank you so much for your time today.
Yeah, you're welcome.
Thank you, Dr. Carr, for your time today. This concludes today's show, talking about teenagers' neck and back problems. We emphasize the importance of knowing ways to avoid the impact of neck and back strains. And we learn through the proper care, through chiropractic wellness, nutrition, and exercise to help the teenagers today have a better tomorrow. We will see you next time on The Edge.